patients will often ask us, how much time do I have left? That's a hard question for us physicians. How do you approach that?
Yeah, that's the number one question I always receive from patients. We both see many cancer patients, and that's something they want to know, how much time. Obviously, at different parts of their journey, where they're at in their treatment, certainly those discussions change. And the important thing is to be honest with the patient and their family. I'm certainly very optimistic. Many times we're somewhat aggressive, and we want to do well for the patient in terms of seeing them live longer and respond longer. But you also have to be honest and realistic with them, so they really know how much time they have, so they can plan time best for them for that time, to make sure that their family, and sometimes we have patients that have families in other states, even other countries, to make sure that they have time for the family to know, hey, it's time to bring family members in. I want to make sure they can spend time with their loved one. And so they can start preparing for the time that they have. I think honesty is always important. And like I tell patients, sometimes this is out of my hands, especially as that time becomes closer. I try to give them more not concrete time frames, but more days to weeks, weeks to months, months to years, rather than say you have 10 days, because those decisions really are out of our hands. And our goal is to at least give them kind of a best estimate. And we're not always right, but certainly I think knowing the trajectory of different diseases and where they're at in their treatment certainly can give us perspective to provide to the patient.